Greetings everyone, and welcome to this video on bias which can occur while interpreting the results of your study. The first type of bias is confounding bias, and it is due to a factor which is related to both the exposure and outcome, but not on a causal path, and this can distort the effect of the exposure on the outcome. For example, an uncontrolled study shows an association between drinking coffee and lung cancer. However, people who drink coffee may smoke more, which could account for the association. Here, the coffee is the confounding factor. Effect modification differs from confounding because in effect modification, the exposure leads to different outcomes in subgroups stratified by the effect modifier or the effect modifying factor. The third type of bias is known as lead time bias, in which early detection is interpreted as increase in survival. However, the disease course has not changed. For example, breast cancer diagnosed early by mammography may appear to exaggerate survival time because patients are known to have the cancer for longer. And the fourth important type of bias which can occur during interpreting the results is length time bias, in which screening detects diseases with long latency periods. However, diseases with shorter latency periods are not detected because they become symptomatic earlier. For example, a slowly progressive cancer is more likely to be detected by a screening test than a rapidly progressive cancer. Now, how do we mitigate bias which can occur while interpreting the results? So, how do we mitigate confounding bias first? Now, if we perform multiple or repeated studies, we can help by getting more data, and we can reduce the effect of the confounding factor. We can also perform crossover studies where subjects act as their own controls with a brief washover period in between. We can also match patients where patients with similar characteristics in both treatment and control groups have been allotted. We can mitigate effect modification by stratifying the population by the effect modifier. We can mitigate lead time bias by adjusting the survival according to the severity of the disease at the time of the diagnosis. And finally, we can mitigate length time bias by performing a randomized controlled trial where we assign subjects to the screen program or to no screening at all. So that's it for this series. Thanks for watching.